18-year-old male presented with vomiting, headache, and blurred vision.
دكتورة زينب عادل. زينب عادل موجودة؟
نعم أستاذ، صباح الخير.
صباح الخير. هذه بليرد فيجن. الدكتورة زينب فيصل عرضتها الكيس، علقي لنا عليها بنيتي دكتورة زينب.
دكتورة هذا T2.
نعم.
هذا T2 flare.
axial MRI. اوكي.
هذا T1.
18 سنة ميل بوي يعني، عنده بليرد فيجن، وهذا الام ار اي مالته.
هذا T1 surgical.
شنو شفتي بنيتي؟
أستاذ MRI study of brain, multiple sequence T1, T2 flare and post contrast T1. There is heterogeneous, well-defined heterogeneous mass within fourth ventricle.
Excellent.
Dilated fourth ventricle and cause hydrocephalus.
صحيح.
Cause hypointense signal in T1, hyperintense signal in T2 and the flare, and heterogeneous enhancement in post-contrast study.
صحيح. بس avid enhancement مو؟
Avid enhancement, yes. With the areas of low signal within the lesion.
Signal void تقريبا indication
Yeah.
of
blood vessel or calcification.
يعني hypervascular. بعد اكو شفتي شيء؟ اوقفي هنا اوقفي.
Yes. Upper cervical spine. Also
spine low cord, upper cervical cord.
Cord, sorry. Also there is avidly enhancing small nodule.
صحيح.
It's intramedullary. Looks intramedullary.
Excellent.
أستاذ عندنا بس sequences، إيش كم sequence abdomen كانت يعني complementary.
اوكي.
اللي هي هاي، هذا T1.
شوفي هاي بنتي.
نعم أستاذ.
أنا كلش واضحة.
شوف الليفر يمكن شفت اني.
renal.
دكتورة؟
أستاذ renal right renal small يعني small cyst.
بلي.
And also pancreatic and this is T2 study. Also multiple يعني tiny cyst within pancreas.
بالضبط. إذا صار عندي pancreas مو large همينة شوية. prominent size.
Yes.
prominent size مو صحيح ومultiple parenchymal cyst وعندك renal cyst. اوكي. بس هاي لازم يكون سبوت هذا.
Yes, يعني we have two brain and spinal cord lesion and abdominal lesion. It's von Hippel-Lindau syndrome.
Excellent. وهذا الكورد lesion.
It's hemangioblastoma within cord and within brain.
اي لا توقفي زينب فيصل لا شو اسمه. بعد اكو هذا السكشن شكو تشوفين به؟
أستاذ right orbits.
Excellent. شبيه؟
Looks large and there is retrobulbar lesion. It's high signal intensity. This is this is T2. It looks high signal intensity.
بالضبط اكو abnormality كانما حتى retinal detachment اكو اي فهذا الشيء تخليني ببالي كمينه.
Also with the von Hippel-Lindau, it's also retinal lesion, hemangioblastoma.
Hemangioblastoma او ممكن ميتاستاسيس يسوي الهمنجيوبلاستوما ميتاستاسيس.
استاذ لا ما سوي
بس سيدنج بالانترا كرينيال يسوي ممكن سيدنج. اوكي شكرا دكتوره زينه. دكتوره زينه فيصل احكي لنا
استاذ هذا
زينب
العفو استاذ هذا البيشنت اجانا عنده بليرد فيجن وهيديك وفوميتنج. طبعا هو عنده فاميلي هيستوري اوف فون هيبل-ليندو ديزيز، فطلعت عنده هذا الليجن. طبعا هو هذا الفيرست اكزامينيشن له، فطلعت انه عنده هذا الليجن هو اللي يعني احنا شفناها بصراحه بوقتها يعني بالابر بارت مال سيربيلار فيرمس اللي هو يعني التيبيكال ابييرنس مال هيمنجيوبلاستوما اللي هو يعني سيستيك ليجن والسوليد نيورال نوديول وبها اريا اوف فلو فويد وبها ابيد كونتراست ابيد يعني بوست كونتراست انهانسمنت وانذر ليجن ان ذا يعني opposite to C2 and also another lesion يعني in the orbit اللي هو راح يعني for further يعني ophthalmological examination يسوي له يعني further assessment. فسوينا له سيرفي another survey ابدومين، بس طبعا كل السيكونسات ما طالعه عندي بالابدومين، ما مطبوعه على الفيلم. هاي اللي طلعت عندي اللي هي multiple pancreatic cyst وطلعت عندنا رايت ريال cyst كلهن سمول. فالبيشنت مش انه هي فون هيبل-ليندو ديزيز. استاذ عندي بس توك اوكي يعني اقدمه.
بس هذا اكو بالبيتويتري هنا اكو فد شيء
بيتويتري
ارجعي هذا لا هذا السكشن نفسه اللي كان موجود.
لحظه شو راح
شباين هذا شنو؟ لا ارجع بعد قبله واحد. لا ارجعي بعد واحد. بعد واحد هاي كبريها بالله. لا ارجعي ليش عبرتي؟
اوكي
كبريها بالله هاي الايمج. هذا تيتو مو
هذا تيتو.
تيتو شنو هذا؟ اكو فد ليجن نانا سوبراسيلر اريا. هذا شنو؟
ما اعرف بصراحه يعني ما علقنا عليها بوقتها.
دا تشوفوه استاذ محمد؟
هلا طلعنا بالساجيتال. شوف الساجيتال والله
ساجيتال بالله شوفي
ساجيتال تي 2. انا شوف الساجيتال تي 2 لو تي 1 هذا تي 1 هذا تي 2
امشي على كيف تشوفوا. طلع بتويتر
اوك في الميد لاين.
اي اوكي بالله كبريها البتويتري خليها بالوسط.
بتمشي اوكي.
هسه
اوكي
ماكو شيء. اوكي الظاهر كانما فد اسمه سكشنال يعني مبينه كانما ليجن. هنا حلوه الستوك هم مبين ولا. اوكي نروح على التوك بابا دكتوره زينب. نروح على التوك.
استاذ اول شيء حاحكي عن فون هيبل-ليندو بعدين حاحكي عن هيمنجيوبلاستوما. الفون هيبل-ليندو disease characterized by the growth of numerous benign and malignant tumors in different organs, at least 40 types, due to mutation in the von Hippel-Lindau tumor suppressor gene on chromosome 3.
صوتك بعيد زينب.
صوت بعيد؟ اوكي.
عندي صوت.
هسه اوكي؟
اي زين هسه.
Okay. The diagnostic criteria for the disease are three. هو يا إما more than one central nervous system, hemangioblastoma, or second option إنه one CNS hemangioblastoma with a visceral manifestation or any manifestation with family history of one Hippolyndo disease. The disease is rare with an estimated prevalence of about 1 to 35,000 to 50,000. Most patients are diagnosed with their first tumor in early adulthood. Mean age at diagnosis of initial tumor is 26 years. بالنسبة للclinical presentation is varied depending on the site of the disease manifestation. Most commonly, these are either within the abdominal cavity or affect the central nervous system. Distribution of the disease including abdominal pelvic. First, we have renal lesions occurring in about 67% of patients, which include renal cell carcinoma, usually of the clear cell type and frequently bilateral, and 70% lifetime risk. RTCs present at an earlier age, mean 39 years in those with one Hippolyndo disease. It may present as a renal cyst, which can occur in about 75% of patients, tend to be bilateral and multiple, can be simple, complex, or cystic RCC, and also it may be presented as angiomyolitomas. بالنسبة للadrenals include pheochromocytoma in about 25 to 30% of patients, and extra-adrenal pheochromocytoma ganglioma in about 15%. Pancreas may be the earliest manifestation, which include pancreatic cyst and pancreatic endocrine tumor, which is usually of the non-functional type and frequently multiple. Also, it may be presented as pancreatic cyst, serral cyst adenoma in about 12.5% of patients. Liver may be presented as a liver cyst. Urogenital include epididymal cyst, papillary cyst adenoma of the epididymis in about 35% of patients, and the broad ligament cyst adenoma. بالنسبة للcentral nervous system include the CNS hemangioblastoma, which occurs in about 70% of patients. الdistribution يعني CNS hemangioblastoma include the cerebellar in about 60%, spinal cord 30%, which is most commonly in the cervical and thoracic cord, brainstem, and also it may be presented as choroidal plexus papilloma. Head and neck include hemangioblastoma, which most common presenting feature occur in about 45 to 60% of patients. Vision loss in about 35 to 55% of patients. Only large lesions can be seen on contrast enhanced CT or MRI, and the lesion demonstrate higher signal intensity than the vitreous on T1 image and may show contrast enhancement. Also, another distribution is the endolymphatic sac tumor, which usually occur in about 10 to 15% of patients, bilateral in about 30%, and considered pathognomonic for von Hippel-Lindau disease. على مود نتذكرها انه عندي النيمونيك اللي هو هيبل، الاتش represent hemangioblastoma، الاي increased risk of RCC، البي pheochromocytoma، البي another P is the pancreatic lesions that include cyst adenoma and cyst adenocarcinoma. LE is the eye dysfunction, which include a retinal hemangioblastoma, endolymphatic sac tumor, and the L is the liver, renal, and pancreatic cyst. And the classification of von Hippel-Lindau disease can be classified according to the clinical phenotypes, and the classification correlate with the particular genotypes. Type 1 is the low risk for pheochromocytoma, but higher risk for CNS hemangioblastoma, RCC, pancreatic cyst, and pancreatic neuroendocrine tumor. We have type 2A, B, C. A is a high risk for pheochromocytoma, low risk for renal cell carcinoma. Type 2B is a high risk for pheochromocytoma and RCC. Type 2C is the high risk for pheochromocytoma only. بالنسبة للتريتمنت and the prognosis, most lesions are treatable and surveillance is recommended with the various regional guidelines. Some experts advocate routine screening starting in the adolescence. Prognosis is poor with the median survival is about 50 years. طبعا هذا البروجنوسيس يعني for overall lesions. Median age survival is about 50 years, with the most common cause of death being renal cell carcinoma and cerebellar hemangioblastoma. This is an example of multiple pancreatic cyst, patient with von Hippel-Lindau disease. This is also another example, another picture, multiple pancreatic cyst, multiple renal cyst. This is also multiple pancreatic cyst, and this is multiple renal cyst. This is an example now of bilateral pheochromocytoma in patient with von Hippel-Lindau disease. The left one showing area of central necrosis. This is an example of the multiple pancreatic cyst and right-sided pheochromocytoma, adrenal pheochromocytoma. This is an example of bilateral RCC in patient with von Hippel-Lindau disease. This is an example of hemangioblastoma in the spinal cord, in the cervical and in the thoracic, اللي هو cystic area وبها solid neural nodule show evident enhancement post contrast. بالنسبة للهemangioblastoma of the central nervous system, it's a tumor of vascular origin and occurs both sporadically and in patients with von Hippel-Lindau. This is WHO grade 1 tumor and can occur in the central nervous system or elsewhere in the body, including the kidneys, liver, and pancreas. These tumors generally present on imaging as sharply demarcated homogeneous masses composed of cyst with non-enhancing wall, a mural nodule which vividly enhances, often with a prominent serpentine flavoids. Epidemiology, hemangioblastoma typically occur in the young to middle-aged adult, and although they are most common primary intra-axial infratentorial tumor in this demographic, they are nonetheless uncommon in absolute term. They are estimated to account only 1 to 2.5% of all intracranial tumors and approximately 10% of all posterior fossa tumors. Slight male predilection. Slight male predilection. Peak incidence is around the 30 to 60 years of age, but earlier in patients with von Hippel-Lindau. Sporadic cases make up approximately 75 to 80%, with the remainder being found in patients with von Hippel-Lindau. إذا الهيمنجيوبلاستوما هي more prevalent. معظم الكيسات هي sporadic. اللي تيجي ويا von Hippel-Lindau disease is less prevalent. Clinical presentations most frequently present with symptoms relating to headache, 70%, hydrocephalus and symptoms of raised intracranial pressure, cerebellar dysfunction, altered mental state, polycythemia due to erythropoietin production occurring about 20%. One study that showed von Hippel-Lindau patients in the onset of symptoms usually coincides with the development of a cystic component, and they show that the solid cerebellar nodules were mostly well tolerated, and they suggested repeat image at this stage to document the size of the cyst and to plan a tumor excision. Acute presentation due to significant hemorrhages and uncommon and tend to be seen in larger tumors more than 1.5 cm. بالنسبة للlocations, it include intracranial 87 يعني to 97 اللي هو 95 in the posterior, 95% the posterior fossa, 85% the cerebellar vermis, 10% cerebellar hemisphere العفو, 10% in the cerebellar vermis, 5% in the medulla, and only rarely do they extend beyond the cerebellum into the cerebellopontine angle. 5% is supratentorial, typically in the optic radiation. Cerebral hemangioblastomas are only really seen in patients with von Hippel-Lindau, and spinal about 3 to 13%. Its association with pheochromocytoma, multiple RCC, von Hippel-Lindau, اللي هو 45% of those with von Hippel-Lindau develop hemangioblastoma, and 20% of those with hemangioblastoma have von Hippel-Lindau, and also with polycythemia due to secretion of erythropoietin from lesion. Radiographic features typically اللي هو 60% of cases are sharply demarcated homogeneous masses composed of cysts with non-enhancing wall, except for the mural nodule, which is vividly enhancing and often as a prominent serpentine flavoid. Not infrequently, the mural nodule itself has cystic spaces within it. The solid nodules are commonly seen abutting the pia mater. In the remaining 40%, the tumor is solid with no cystic cavity. LCT, the mural nodule, is isodense to the brain on non-contrast enhanced scan with fluid density surrounding cyst. Post-contrast intense homogeneous enhancement of the mural nodule, and the cyst wall do not usually enhance. Calcification is not a feature. On MRI, on T1, hypointense to iso-intense mural nodule, and CSF signal cyst contained. T1 post-contrast show a mural nodule مثل ما قلنا vividly enhances, and cyst wall do not usually enhance. T2 is a hyperintense mural nodule, and slow void due to enlarged vessels may be evident, especially at the periphery of the cyst. seen about 60 to 70% of cases, a fluid-filled cyst similar to CSF, and الMR perfusion increase cerebral blood volume ratios. Treatment and prognosis: surgical resection is usually curative, or the large lesions may be made easier by preoperative embolization. Simple cyst drainage appears to be insufficient for definitive management. Adjuvant radiotherapy may be used in patients with incomplete resections, and the recurrence can be seen at 25% of patients. In differential diagnosis, first we have brain metastasis. Although a single posterior fossa metastasis are uncommon, they are still the most common diagnosis if the patient is middle-aged or older. Second differential diagnosis is astrocytoma, pilocytic astrocytoma in children, and glioblastoma multiforme in adults. Third differential is ependymoma, and the fourth differential diagnosis is AVM with subacute bleed. Vascular lesions include AVM with subacute bleed, cavernoma with subacute bleed, and subacute infarction. And the last differential diagnosis is the medulloblastoma, which usually presented as a much more solid restricted diffusion. This is an example of the left cerebellar hemangioblastoma اللي هو cyst with solid neural nodule and show intense enhancement post-contrast. Also, this is another example. This is a FLAIR image demonstrate not only a rim of high signal intensity surrounding the left posterior fossa cystic lesion اللي هو provoked vasogenic edema. Also, we have abnormality of the left globe اللي هو contrast enhanced T1 enhancing lesion along the peripheral aspect of the globe and enhancement of the retina اللي هو retinal hemangioblastoma.